And we are also thinking about doing more healthcare related stuff beyond COVID. So yeah, glad to be here.
Awesome. Now we have Jennifer. Welcome. I know you got stuck. Okay, thanks for everyone to sticking with us through all these little road bumps here, but I think we're finally ready to go and ask some great questions and get some awesome answers from our awesome panelists. So let's just kick it off. I know we had the other one that Jen asked, what advice do you have for someone looking to break into healthcare UX? I don't think we got to that one.
I think I was called on, but then I don't think people could hear me, or some could. Can you all hear me now?
Yes, we can.
Okay, cool. Awesome, great. So I guess breaking into healthcare UX is no different than breaking into UX. You need to know the process, the methods, general ethics around research. What I would say, what is different is that a lot of people assume, oh, I worked at, a big company, I know how UX works. In healthcare, it's much slower, depending on where you're at. A startup is typically faster. But with a lot of the healthcare regulations and guidelines around how data is exchanged, you need to be cognizant that it can take a while. So if you want to get more education, or you can afford more education, a master's of public health or a master's of science and information with an emphasis on healthcare is a great way to do that. Even a bachelor's degree. I think there's so many UX bachelor's degrees, but there's also General Assembly and other UX boot camps as well that can help you get that foundational knowledge. I'm currently going through a career transition, and what I can say is that with all of the interviews I've had, whether it's healthcare or not, I'm not asked like, how much do you know about healthcare, or how much do you know about e-commerce? It's telling about the process that you use to uncover a problem. So that's what I'll say. Deanna, Ryan, any advice?
Yeah, I was gonna say, okay, like it's mounting, okay. Yes, okay. I was gonna say I totally agree, Ryan. I don't think there's any majorly anything you really need to do differently or need to know that's different from just getting into UX. I think if you have been someone who has received healthcare in the healthcare system and you have empathy for that experience, I think you would be a great, designer. I think some things that helped me, at least, I did have like a healthcare background, but my first job was actually in fintech. So for me, I started just branding myself as a healthcare designer, even though I technically didn't have design experience in the healthcare space yet. And I noticed that just by assuming that as my, what I wanted to do, a lot of the opportunities that came to me were more healthcare focused or in adjacent spaces. So if you want to work in that space, I think just make it very clear to recruiters that that's where you want to be. And then also, of course, have a really strong personal pitch as to why it is you want to work in that space. Yeah.
I agree all above, but for me, something was different is our company was doing like COVID-19 related stuff. So even though generally healthcare is slow, but for us, we need to be super fast because a new policy is gonna change every month or two, and we need to work with different states, government to make sure we fit their requirements. So in that case, have the sort of experience with dealing with tight time constraints, like ability to move fast. That was really important for at least for my company. So I guess my point is just learn more about the company you are applying for, the type of work they do, the type of problem they are solve. So and try to position yourself or present yourself to someone that can fit in that environment.
Awesome. Definitely makes a lot of sense. So kind of, I mean, going off of that, there's a question in here about some of the unique challenges to working in healthcare UX. Ryan, now you were just talking about having to change according to legislation and things like that. Sure, that's a big one. But would anyone else want to add in any of the unique challenges they face?
Something I want to add is I think a lot of times we think about healthcare from the patient perspective. Currently at Roe, I work on a platform team that works with pharmacists and providers and physicians and nurses. And it's been really enlightening, just like, their tooling is also really difficult to use. When doctors come to a clinical decision on how to treat a patient, there's a lot of different data points they need to consider. Every doctor is different in how they land on a clinical decision. So how you make like a scalable platform that can consider all those differences. So that was another piece that I hadn't considered much before.
Yeah, I guess healthcare is challenging, not gonna lie. You're trying to solve a lot of problems in the US, and I speak because I'm in the US, so I speak to the US perspective. But you're trying to solve a lot of problems that are very, I guess, law bound. So you have to find ways in which you're not only meeting those regulations, but also working towards a better experience. I think too, building off of what Deanna was just saying, there's so many levels to healthcare. So you have obviously the patient, then you have the doctor, then you have health insurance, which is a lot. And then, policy, legislation, it just goes on and on. So I think what's challenging is just from the get-go as a researcher or designer in the UX space is knowing what you're doing and how it could affect all those other things. So one thing I always like my students to do is let's think about possible risks that could arise from any of these solutions. And some people are like, oh, well, that kind of takes away from the design process, and it does. But when you're working in such a very delicate space, you want to make sure that whatever you're doing is for the best. So I'd say that's the biggest challenge, is just making sure it's for the best outcome.
Yeah, one thing I will add to Ryan's point is just try to be more open-minded and be willing to communicate with other departments in your company or outside your company. I think a lot of time it requires more patience to communicate with those people in healthcare, because they don't generally understand like design or what. It happens in other industry too, but I would say just in healthcare, you probably need more patience and try to be more compassionate and understand other people's perspective.
For sure.
Mm-hmm.
Yeah, thank you for those answers. And I guess for some of those challenges, can you guys think of like some recent experiences on like how you overcame those challenges, and like what would be the next best action to, like combat some of those challenges?
I can speak a little bit to my experience at Roe. Yeah, so I think I totally agree with what both Ryan said. in terms of like, yeah, working with a lot of different functions that aren't necessarily familiar with product design is really interesting. I think luckily at Row we're pretty good. We're like all our doctors know how to use Figma. They like know how to like be a part of our workshops, but making sure that one, everyone is aligned on what the best patient outcome looks like and how do you actually measure that. And that's probably the hardest part because there's always like trade-offs with how fast you can ship something or how efficient it can be, what can you do quickly versus is like a year-long journey to actually accomplish for a patient. So aligning on that, and then I think aligning on how you measure it and then how you go about building for that. And when you're involving a lot of different stakeholders in different functions, such as like doctors, physicians, operations folks, there's a lot of knowing how to communicate where you're going and why you're making the decisions that you're making, because I think everyone's incentivized for different reasons for their own teams. I think that, that kind of advice can be said about a lot of different environments for design, just like having good design rationale and bringing people along your journey.
I have two things. One is kind of general, and it's exactly what you were just saying, Deanna, is stakeholder management and engagement. I think that's as you move up in your UX career, you get asked more and more like, well, how do you get stakeholders engaged, or how do you keep them bought into your plan, and what do you do? And so with healthcare, you could be working with patients, could be working with doctors, could be working with execs. Just people have very different needs. And so just knowing what the stakeholder needs, which is easier said than done, as we all know, just really make sure you build that relationship, which I can't remember if I saw an ADPlist or maybe something else, but as UX practitioners, you do research, design, strategy, or a hybrid of all three, but you're also kind of a change agent. So you also have to be willing to educate people on, this is what a journey map is, and this is why I'm doing Post-it notes everywhere. So that's one. The other is when I was at a startup, we were trying to figure out what types of, what are they called? Questionnaires or like assessments you get from a doctor before you see an appointment. And that was probably, I thought it would be pretty easy to like, okay, we'll use this one and this one, and we'll see what happens. But you have to remember that, and I had to remind myself a lot, was these assessments doctors use to plan whatever health intervention they're going to give a patient. So, whenever I see it like a mental health therapist, I do these anxiety questionnaires and depression questionnaires, but that may not be true for every type of physician. And so it was just a lot of conversations and research and strategic goal setting as well to help us get to that final decision. But to what Ryan said, it's a lot of patience and empathy in the space. And it is fun because you're making impact no matter what, despite challenges.
Yeah, that's a really good example. I can talk about recent big changes we had to go through is for those of you not in US. Now in US, there's a program called HRSA uninsured program. Basically, it allows company like us to provide free or no cost test to patients if they don't have insurance. And that program doesn't have fun anymore. So we just have to change our product to make sure like we accommodate that. On federal level, there's no funding, but on like state level or certain partnership level, we can still get some funds. So this is gonna be a huge change in our product, but also we are kind of like building new product for healthcare. So for us, we really need to think about how much time, resources we can spend on making those changes versus how much time we should spend on our new product. And then if we are making those changes, what are some changes we can do quickly to make sure we are not losing money? And what are some changes we can do, like a fast follow-up, or maybe in next month something, so we can provide a little bit better experience to our patients. And maybe if we have more time, what else we can do? Just think it as more sort of iterated way. So we all don't always get to design or develop the ideal version we have in mind. So just think about the kind of steps we can take to be that sort of ideal position.
Awesome. Thanks, guys. Yeah, I definitely can relate to a lot of what you all mentioned. I'm currently working in a digital product design team in a really large hospital, and stakeholder management is huge just because our team is brand new and there's people that have been working there for 20, 30 years in marketing and IT and all that good stuff. So it's definitely a unique challenge, but a fun challenge, like Ryan mentioned. And also, I'm looking in the, I've seen in this chat here and also on the Slido, we do have a pretty good handful of people that are either making the transition from being a healthcare worker into design. So I'd love to know if any of you guys have any advice for them, if they've worked in healthcare before and are looking to transition more into product design, and how they can make themselves stand out.
I would just say, like any other interview, play to your strengths. So I don't know if the folks who are looking to transition are looking to move into like a healthcare digital area or company. Sorry, it's been a long day. So I would just say, like, emphasize what you learned as a nurse or a dentist or whatever profession you had, and say why that makes sense, or like what made you want to switch into tech. What were you seeing that you want to change? That's what I would say, but I'm not a medical professional.
Yeah, I would say the similar thing, since folks work in the healthcare before. I mean, yeah, so you have like first-hand experience talking with patient, understanding their pinpoint. You probably have the passion to make some changes in the industry. So find a way to show that during your interview or even on your portfolio, show that you want to work for the company, you understand the space, and you're just ready to get into.
Yeah, I definitely totally echo both of your sentiments. I think first of all, we need more people from diverse backgrounds in design. I think having designers who also have a background in healthcare, who want to work in healthcare, is amazing, because like someone mentioned in the chat, there's just like a lot of different types of people who need healthcare. So having more people from those diverse healthcare environments is really important. I'm trying to think of what might not be a repeat of what both Ryans have said, but I think in addition to telling your story and like why you want to work in design, making sure that you specifically call out how things you do in your day-to-day directly translate to value for the company. Like if you're thinking from like a recruiter's point of view, they're just quickly trying to see like how can you add value to my company that I'm hiring for, or this role. So, if you're like, I'm a nurse and I work, with patients every day, you can talk about how you understand how to work between like analog and digital systems, or like have really deep empathy, or have like a more nuance in how you might interview users, or because healthcare is very sensitive for some people, and it's also very stressful, so the way you go about talking to patients is also very nuanced. So yeah, just playing on your strengths, directly connecting them to some value that a tech company or a company might want to hear.
Yeah, thank you for that. And I also wanted to try to put a little bit of a focus on submitting the applications themselves. Do you guys have any advice on like maybe the cover letter or formatting, like a resume or an application if you do have former healthcare experience? I'd be really curious to know that, because I don't know how it is for your companies as well, but I think product designer roles usually encompass maybe end-to-end design. So maybe you're doing user research too. Do you guys have any advice on maybe how like having, this expertise in healthcare and experience in healthcare can maybe help facilitate you in those research sessions? Sorry, that was like a two-part question, but
I guess for me, it doesn't, I don't know, I guess I kind of apply to jobs all the same way, so I'm maybe not the best person to ask. What I will say is a lot of companies are just looking at resumes, and some are even just looking at portfolios, which is great because then you don't have to, rely on the long application process and the waiting. And you have much more flexibility to tell your story in those types of materials. But in terms of how to leverage your healthcare experience, obviously keep it on there, and also make sure you have either some research or design, whether they're projects or positions you've held, to make sure those are listed as well.
Yeah, I totally agree with that. I think at your core, you should have like good design chops and craft. And like I mentioned before, like for me, I just started branding myself as a healthcare designer, and mentioned things I had done in my past that lent it to being to me being a good candidate as well. I think something like thinking about a portfolio, for example, showing projects that are more complex in the sense that maybe they touch, it's not just all in the digital space, like it's something that touches an experience that happens in the real world too. It doesn't have to be in healthcare, but that demonstrates that you can, it's like basically an analogous example of working in healthcare. So having a lot of different touch points that aren't all digital, working on, or just sharing projects like that are helpful. And then I think how to frame your healthcare experience on your resume. I think one, talk about like your impact and relationship to patients or other people in the healthcare space, such as, maybe insurance, I don't know, billers or doctors. And then also trying to bring up like metrics or data around the impact you had in something, because I think for me, when I look at candidates who are career transitioning, I think they have the advantage in that they've worked in a professional setting before, so they know that things aren't so easy as they might seem in school, where you like follow design in a linear path and like you have all the time in the world to do something. So I like to see if somebody has, really taken on and taken ownership over something and like seen it through the end, because I think you can learn how to do healthcare design like on the job, but like taking initiative is something that is like a soft skill that everyone can build.
Yeah, I agree both of these points, and also the point I was trying to say, it's very similar to what Anna just posted in chat. Basically, just can leverage your existing network, whether that's you work in a company has a product design team, or you used a product before that has a design team, reach out to them and just use your experience as sort of a starting point to as a connection point to reach out to the designer on the team and to say things like I choose your product in my work, and it helped me to communicate with patient better or whatever, and just use that as a way to start networking. If you don't like know what else to try. As for the research part, I think it will be similar. Just think about how you communicate with patient before, how that could translate to understand user, how to ask questions, all that. I guess just leverage your experience. I think there are for sure something you can transfer into design.
Yeah, thank you for that. I think a lot of people coming from healthcare definitely learn, those soft skills, like how to talk to people. So that is definitely transferable things. But do we have any other questions? Anna, I don't know if you wanted to ask one next.
Yeah, so I'm looking in here. A lot of the questions in our Slido are a little bit repetitive. We've kind of talked a lot about the challenges of healthcare. Definitely we can continue on and on for days about all the different nuances and everything. But there is this one interesting one about what are the emerging trends in healthcare and opportunities and challenges for the product design industry in healthcare. And I guess, how do you guys understand what the emerging trends and things like that are, and how do you incorporate that into your work?
I was just gonna ask, like, do you know if they're asking in general or like digital?
Yeah, that's interesting, because there could be emerging trends in the digital space, but then there can also be emerging trends in the healthcare space.
Right.
So maybe like a cross between those two.
At the intersection.
Yeah, I think as designers, we can focus more on digital, but I mean, depends if you guys have any other things to add.
Yeah. Yeah, I know. I mean, for me, I guess some things I see trending in digital would be like AR and VR things. So I'm curious, like in the healthcare industry, would they be as innovative, or like, are they aware of those kind of trends? Maybe is something I'd be curious about.
I know Oracle did I vaguely remember reading it, but they did something with their technology where they were able to support med students getting access to it in order to have better practice and visualizations for looking at human anatomy. I don't know. I think the biggest thing is obviously digital health. With COVID, that just amplified it. Dan, I'm sure you and Brian, you both could speak to how it's affected your startups. But honestly, I think that's the biggest thing right now, is just trying to make as much healthcare as accessible as possible, whether that's through digital means or not. If you're interested in learning more, I would recommend just looking up, I think it's called Rock Health. They publish a lot on like what's happening in the healthcare startup space. But if you're a nerd like myself, and maybe most of us here, maybe picking out one of your favorite academic journals and subscribing to them. I'm on HIM, or not on HIMS, but I subscribe to HIMS, which I think is Health Informatics, Medical, Social Science. But they're constantly sharing like what's new in healthcare.
Yeah, I was gonna say like accessibility is a really big one. I think when I think about where healthcare is going, I think like fintech is kind of like one of the first really meaty, like complex spaces to be disrupted, and like healthcare is now kind of starting to burgeon. So I don't know if there's any like front runner in the space, but I would say accessibility is a huge thing. There's like healthcare deserts, meaning there's just like a lot of rural areas that don't have access. I think another area that is being tackled a lot right now is like healthcare finances. Like, how do you help people save and prepare for unexpected medical costs? How do you innovate on health insurance, employee benefits, since at least in the US, your healthcare is tied to your employer. And then I think something that I don't know if I've seen any company do it super well yet is like, how do you handle chronic conditions like, diabetes? I think a lot of products I've seen or solutions out there, at least in the, I guess the consumer space, is around like fixing one problem for a very limited amount of time. But how do you actually if it's a lifelong problem, how do you help that? I think a lot of stuff might be more in preventative health these days. Those are some of the things that I'm thinking about that is where there's opportunity to understand and build upon. And then relating to Jennifer's point on like AR, VR stuff, a designer I used to work with had worked at a startup where they were like building games that had interactions that would match like physical therapy. So basically the gamification of physical therapy. So making games that helped you perform the physical therapy exercise. So I think there's just like a lot of startups out there. There's it's still growing. So
yeah, that's super cool. Super cool.
On the accessibility note, I think one, I guess, trend is everything become more digitized. Like all the health record can, I guess, live in the cloud, can be shared with different services. But at the same time, there are also some physical stuff. Like for example, for COVID-19 related, there are companies doing sort of, you can just buy COVID-19 medicines directly from on the website, and it will send to your home, similar to like COVID-19 testing as well. So I think people are trying to make it easier for people to get healthcare by like sending stuff directly to your home. And another thing, it's kind of different from what I just talked about, but still related to physical space, as there are a few, I guess, healthcare company are building like a specific location or building their own clinic office, which can integrate with all the digital stuff, but also have so as a brand, it has like similar design, similar style, all that. I think that might be also another trend as well, where company just make sure their physical experience and digital experience are kind of aligned. And that could be where, if you previously working as health worker, that your experience could also be beneficial because you understand how the physical experience works, and then when you want to transition to digital experience, like you may have a better idea how to bridge those two things. Yeah.
Yeah, I think you touched on a really interesting point about like bridging into the digital space from healthcare. Because now that I just remembered, I had an ad today about like delivery services for like healthcare type of things. I feel like that's a emerging trend too. It's like, oh, you need a COVID test, get it delivered to your door. Do you need, like certain medications? They're like services and products that you can just order online now. And they're all digitizing that, used to be like go into the doctor and you have to get a referral note. I think another thing I'm seeing is like telehealth, like mental health, or like kind of those sessions are becoming online too. We have like, Talkspace and Cerebral. That's pretty interesting. I feel like it's an emerging space as well in the healthcare industry.
And I know, I mean, we were talking about like accessibility and things like that, and it reminded me of a question I saw in the chat. Like while I was in my boot camp, I was always taught that if you design for everybody, you design for nobody. But I kind of think that healthcare is a little bit unique in the way that you really do need to design for everybody. And so how do you handle, I mean, of course, there's specific use cases and things that you need to be conscious of, but it's a unique challenge to create healthcare products that are really, targeted for anyone that accesses healthcare. So I'd love if any of you guys could speak on that and how you, do your design process and still make it tailored and useful solution.
Yeah, I would say even though technically you are designing for everyone because healthcare audience needs to be everyone, but at the same time, if you consider a more how should I say it, more extreme scenario, or more if you consider people with the like need better accessibility care, then you're gonna bring a better design to everyone in general. So like for us, I think one consideration we had was make sure the font is big. Like our font is generally bigger than most websites, just because it makes it easier to read. But so like that, everyone can benefit from that. But at the same time, you also want to make sure like you don't clutter the surface too much. The interface with too much information, all that. So yeah, I guess my point is if you just design for those people need more accessibility consideration, then you end up gonna with better design for everyone.
I think I heard this so Microsoft every year does, I used to live in Seattle, so I used to go, but every year they do, it's called the Ability Summit. And I think now it's virtual because of COVID. So definitely go if you can, or I guess virtually attend if you can. But I think at that conference, I remember someone saying something like, if we design for the most marginalized and vulnerable populations, then you are designing for everyone, because then, like, let's say someone who is currently living in a wheelchair, if you're designing a ramp for them, how many of you also enjoy the ramps to have a gradual walk up to the front door or something? So that's kind of what I've tried to embody a lot in my practice is, some people see it as, you're getting too narrow. I see it as we're just trying to make it the best experience for everyone involved. With healthcare, for the most part, at least the projects I've been working on, you are pretty narrowed on like what population you're working with. So like, for instance, I worked on designing a mobile app that provided Moroccan women with pre-pregnancy and post-pregnancy information. So, the target audience was young Moroccan women living in rural villages between the ages of, I think it was like 10 and 30. So kind of like with any product, you have some direction, but yes, with healthcare, you do need to make sure most everyone has access to as well.
Yeah, that's like probably the hardest part about working in healthcare. I was gonna add that like sometimes design, like you won't have inputs from the populations that you need. So I think sometimes in a more, thinking more from like the product development cycle and all that stuff, sometimes just solving for like the 80% of the use cases and then creating like other accessible experiences that can support the 20% that aren't covered in that 80% use case is kind of how I have seen it being approached. So for example, like at Row, we have a lot of different conditions that we support, and some people have very basic needs for solving their condition, so we build our basic version of our workflow to support those 80% users, but then we might maybe offer like more ways of interacting with our doctors to support that 20% of the population. Like some older people don't feel comfortable using digital apps, they'd rather like call somebody. We offer texting for people who don't like calling people but want to interface quickly with somebody, especially for our mental health offerings. Like that's really important because you never know when someone is in need of help. So that's another approach that I guess kind of is on the contrary of like designing for the most needed users. Yeah.
Awesome. So I know we're 3 minutes after the hour. Is everyone okay to stay on for another like 10, 15 minutes, just because we had some technical difficulties in the beginning? Awesome. Just, I know we're sharing so much awesome knowledge here, and want to get to a couple more questions. So anyone else that needs to drop, this is being recorded, I believe, so you'll be able to catch them. Awesome.
Yeah, there's a lot of good healthcare topics. We might have to do a series.
Yeah, we might need to do another. There's so many questions in here.
I guess since we're running, close to the hour, including the technical difficulties, should we go through any like top voted questions in Slido to see if anything was missed? Okay, so I know there was one, dialing it back a little bit. There was a question asking, for the amount of problems in healthcare, it seems very overwhelming. As a designer, how do you prioritize those problems, I guess, in your day-to-day? I guess for like healthcare product design, do you guys typically work in, like a scope for a project, or is it kind of like ongoing problems? Like, when do you know a problem has been solved? I guess is how I'm thinking of the question. How do you prioritize which problems to work on first?
I'll answer that. Or did you want to?
No, go ahead. I was like, oh, this is a fun one.
Yeah. So let's see. Yes, there are a lot of overwhelming problems. And I think, like you mentioned, Jennifer, it's not something that you like solve and then you move on. It's very iterative. Like you maybe solve enough to get what you need right now, and you can iterate on it later. At least at Row, we prioritize problems at the get-go, and we do it cross-functionally. So talking to our physicians, our nurses, our pharmacists, and coming up with our OKRs or product roadmap together, and also the strategy around it. And so they're involved in our brainstorming workshops as to like what our top problems are. And then we have like dedicated data scientists who help pull data to make sure that we have like the patient perspective or patient data as well. how to keep the scope very specific is really hard. So I think this is where, like the product management, like prioritization frameworks come in. So what is like the amount of resourcing you have? What's your timeline? A lot of problems aren't solved quickly. So how do you like slice that into smaller slivers so that there's, momentum in getting, wins out to the patients or to the doctors. We also like make sure we have like anti-priorities, so things that we are not going to be focusing on in this first launch, but it's like it's on our radar that we are going to work on these in the future. And then I had one more thought, I'm trying to remember. Oh yeah, I think again this comes back to like really being clear about how you measure and define success. So like what is the patient outcome? How can that be broken up into smaller pieces? A lot of times, at least at Ro, like our healthcare systems all touch each other. So like our pharmacist platform touches our physician platform, touches our patient platform. So it's usually a collective effort from multiple teams to really push through something. So making sure that everyone understands what the goals are and like what solutions different teams can support, and then communicating that out.
Yeah. That's I think just mentioning like a product roadmap can really answer, that questions for some of our, career transitioners. And for our career transitioners who might not know what a product roadmap is too much, can you guys speak a little bit more on what that is?
Yeah.
Yeah. We have research roadmaps. So I'll let you two speak to product roadmaps.
Yeah, I can start. I roadmap basically is just a plan for when you want to your product to be in a certain stage. That could be like you need to have this feature by when, or that could be you need to have that's one goal, but we do that too. Like we need to have this amount of user or transaction by what time. That's usually need to work with product manager, CEO, all the people to get that sort out. And for us, a kind of unique thing is also we really want to think about what happens in where we want to be in next 5 years. So and all of our roadmap gonna just try to make towards to that North Star. Yeah, that's pretty much what we are doing.
Thank you for that. Anna, did you want to ask any other questions that weren't?
I've seen a couple about engaging with stakeholders. I know we did kind of mention that that is a challenge, be it, physicians, here it says physicians, patients, providers, etc. We're wondering here, how specifically do you guys tackle, getting engagement with your stakeholders and getting buy-in on your projects? There's another one about selling the value of qualitative research over quantitative engagement and things like that. So that's kind of another question that can go in there at the same time.
I'm happy to take the qualitative one. Yeah, I'm not gonna lie, that's a very rough discussion to have in the real world. People love numbers. People love seeing things grow, and you can't necessarily do that with qualitative research. People love quotes, but in my opinion, that's not qualitative research. That's an outcome per se. So I guess for me, the way I've tried to do my best with selling qualitative research is, so I guess for those who don't know, qualitative research is basically asking people questions and you're getting open-ended responses. You're taking down whatever they're saying verbatim, and then you are categorizing it into themes that look similar or sound similar. And then you do a thematic analysis where you look at those themes and then you try to understand like, what is it people are really trying to say, which is subjective compared to regular statistical analysis. You plug the numbers, it gives you an outcome. So what I try to do is typically people write up a report on qualitative research. I try to make it visual as much as possible. So I try to always turn it into a journey map or a word cloud. Those really get people, as well as I do use quotes just to like show people like, people are saying XYZ about our product and here are examples. So I am very against quantifying qualitative research because, well, we don't need to go down that road. But, just trying to always tell that story, whether it is quantitative or qualitative. I try to do that even through storyboards. That's been helpful as well. Yeah, I can't remember the first question, so I'll stop there.
First question was sort of talking more about how you get stakeholder buy-in, and even if you're working with actual providers, how to get them involved in your work.
Mm.
So.
Yeah, I think for us, at least for me, I don't know if it's lucky or not lucky, but I'm not usually the one who talk to like providers or governments. So which means for us is we really need to have a good communication funnel with those teams that do communicate with providers, governments, like understand what's like problem they are facing when communicating, and what we can support. And also there are gonna be times when they give us some ask or request that's just impossible to do or unreasonable, and then we need to learn how to push back as to push back for being a product designer or PM. Yeah, I work with our PM really closely. So yeah, I guess my point is just especially for us, have a good communication channel with different teams, whether that's sales team, field ops team, whatever, is also really important for you to do your job.
Yeah, I totally agree with that. I think luckily for me at Row, the company has kind of like set up or like organized our company so that there are that we have like a direct line of communication and processes with our providers and physicians and pharmacists. And I think, so yeah, I think like part of it does have to come from the company, like wanting to make sure those communication channels exist. I think another thing is that from what I've noticed, there are like it's helpful to kind of build relationships with the providers who really seem to be excited about the stuff that you're doing. I think like some physicians or pharmacists are really just focused on like doing, the work. But I think there are some who are like really interested in solving like the problem at large. And I think like those physicians also, like I'm thinking in the sense of like, if you wanted to recruit a doctor for a research study and you like don't work at a healthcare company that has it, I think focusing on providers and pharmacists who are more tech forward, who do want to learn about new technologies and what's going on, I think that they would be more open to signing up for your research study. And I think within that, yeah, just generally, whenever you're working with another function that isn't design, it's always nice to have like a couple representatives or liaisons that can help bridge the gap between you and the rest of those roles.
Yeah, thank you. So I know we are starting to reach our 7:15 mark. So I guess to wrap up this awesome discussion, are there any last bits of advice or comments that you would want to give to all of our guests today? Any like just general advice that you haven't touched on?
I have two things. One, I definitely know there are probably some of you anxious about getting into the UX space. I've been there. I can tell you will get there soon, or maybe tomorrow, who knows. What I will say is, and this was advice one of my mentors gave me, which I still believe, you don't need a UX title to do UX. So if for some reason you are, let's say, a data analyst, take a project you've done, reframe it based on the UX process. A lot of people do that for their portfolios. Pro tip. So that's one thing. Second is for healthcare, don't be afraid to also look into nonprofits. There are tons of small nonprofits looking for web designers, UX designers, graphic designers. Take those roles or opportunities, but then you can, assuming the nonprofit will let you, you can always structure as a UX problem and then go through the process. So yeah, thanks for listening to me, Ryan or Deanna.
I can, yeah, so I guess one thing I want to address, or I did, people probably heard about this a lot, but I want to say again, networking is really important, no matter which industry you are in. So if you are looking to join a healthcare industry, and be sure to reach out to people in the industry, understand their experience, their background, their challenges, like what we do here now, and see, I guess, see which problem you'd like to solve, because there are so many things you can do in healthcare. Find the one you want to, you are interested, and just moving towards it.
Yeah, I think I didn't have too much to add outside of what you both have already said, at least related to healthcare. I think for people who are job searching right now, I know it's like really hard. And it can feel really discouraging, not hearing back, or getting rejected, or not feeling like you have, like you really got to put your like best self in front of a recruiter and whatnot. So I think easier said than done, but like don't let that get to you. I think a lot of job hunting is really like timing, luck, like being in the right place at the right time. And it's more a matter not of like your skill. Like if your skill is strong, it's more about the number of times you're like at bat and just like trying to get in front of people, because you never know when like that recruiter or that hiring manager just happens to open your LinkedIn message or see something that you post, and go from there. So hang in there is what I'm saying.
Absolutely. And people are definitely not alone if they're in that struggle. I think we've all been through the job search process. It is not fun, but you know, I always just like to remember that interviews go both ways, and you know, if the company wants you, they'll let you know, and you'll feel that great feeling about it. So stay positive. But I think we've been on here for a little while now. We definitely need to do another healthcare focused session. There's so many awesome questions in this Slido here, but thanks, Jen, for putting all of our mentors' ADPlist links in the chat. Definitely check them out, book time with them, connect with all of us on LinkedIn. Happy to answer any other questions. And we hopefully will see you guys soon. Thank you all.
Yeah, thank you everyone for coming, and thank you for our panelists to, you know, speak on your healthcare experiences.
Yeah, thank you guys.
Bye.
Thank you
Thanks.
for having us.
Bye.
Bye.